Welcome back to the Girl Doc Survival Guide. Today, I am very pleased to be with Dr. Jag Bhawan. Dr. Jag Bhawan, MD, is the Guido Meinl Professor of Dermatology and Pathology, Head of the Dermatopathology Section, Director of Teledermatology, and Vice Chair of the Department of Dermatology at Boston University School of Medicine. He is board certified in anatomic pathology, dermatopathology, and dermatology. He has published over 275 original articles, authored several book chapters, and co-authored an interactive online dermatopathology atlas. He serves on the editorial boards of the American Journal of Dermatopathology and Dermatopathology. He is the 2006 recipient of the Walter Nickel Award for Excellence in Teaching of Dermatopathology and received the 2008 Founders Award from the American Society of Dermatopathology. In recognition of his long-standing contributions and commitment to the institution, Dr. Bhawan was inducted into the Chester S. Kiefer Society at Boston University School of Medicine in 2009. He received a Certificate of Appreciation from the International League of Dermatological Societies in 2015 and has been named a lifetime honorary member of both the American Society of Dermatopathology and the Indian Association of Dermatologists, Venereologists, and Leprologists. Most recently, in 2023, he was inducted as a fellow of the William Fairfield Warren Society in recognition of his distinguished contributions to Boston University. Thank you for being here today.
Thank you for having me.
You have had many accomplishments, only some of which I just listed. Could you share a personal anecdote?
So back in my early career, when I just started dermatopathology service at University of Massachusetts Medical School, I was thrown into a place where there was nobody else around me to consult, to discuss. Like we have now in most academic institutions, we have conferences and we have colleagues that we can bounce our cases off. In this situation, I was alone and I was very young. I just finished my training in 1975 and joined University of Massachusetts. And we had a case of a patient who had deep skin lesions in the thigh and buttocks, and a biopsy was performed. And as a young dermatopathologist, I looked at the slide and I found that within the vessels, there was tumor cells. And these tumor cells resembled atypical lymphocytes. And I looked at the history of this case. It turned out that the patient has a lymphoma. So very naively, I felt that this is a lymphoma involving the blood vessels of the skin. It was simple, right? Then the case was referred to outside institution for radiotherapy. The pathology department there reviewed the slides. There was a visiting English pathologist at that time who looked at the slides and said, "Oh, this is wrong diagnosis. This is angioendotheliomatosis proliferans systemizata. For the sake of the rest of the talk, I'm going to call it APS. I had not heard of this condition. I was petrified that I made a mistake early in my career, and I was quite upset, to be honest. However, I looked at the slides and I felt convinced that these are really atypical lymphocytes and not endothelial cells. In those days, there was no immunohistochemistry to speak of. This is 1977, 78. Only specialized labs had something, but nothing what we have today. So I'm also an electron microscopist, so I decided to do electron microscopy on this biopsy and actually showed that the endothelial cells were quite distinct than the tumor cells within the vessels. We also did electron microscopy of the buffy coat of the blood from this patient and showed that the buffy coat showed cells similar to what were in the vessels. So we were convinced that this is really a lymphoma going in the vessels. So we tried to publish it. And as you can imagine, there were big names associated with APS, including Big Master in Yale and elsewhere in Europe, because they're the people who described this condition. So it was very hard. The Cancer Journal agreed to accept the paper if we put a question mark on the diagnosis. So we said intravascular lymphoma and APS, one disease, question mark. That is how it was published. And as luck would have it, Or 3 years later, I went to do my dermatology training at Boston University and Tufts, which was the joint program at that moment. And we had a similar case this time. And the case came as no previous history of lymphoma, only the skin lesions. The biopsy showed the same exact pathology. So I wanted to say intravascular lymphoma, but I said maybe this is whatever they call APS. It turns out 2 days later, patient has exploratory laparotomy because of acute abdomen. And she has actually a jejunal lymphoma. Now I'm prepared. So at that time, immunohistochemistry came available. I contacted my colleague at MGH, and he performed the immunohistochemistry and showed conclusively that these were atypical lymphocytes. So intravascular lymphoma came in existence.
That's cool. It's hard, right, to push back, especially when you're junior, when you're new, when you feel like other people have more experience. And of course, we can all be wrong too, no matter how long you've been doing a given.
Absolutely.
It's hard.
I think this also illustrates that you should have an open mind. Don't be intimidated by books or papers. If you have made your observation and you think you are right, you need to pursue it. You may turn out to be wrong. It's okay to be wrong. But at least you should pursue. Don't be intimidated by people above you or senior to you or more experienced than you.
Yeah. I like what you just said. You said it's okay to be wrong. This sounds like a stupid question, but I really mean it. Do you really believe that?
Yeah, absolutely. Because it's impossible not to be wrong. If you're honestly practicing anything in your life, right, medicine or otherwise, there will be some decisions or some things that you will do, even in your personal life, that you will realize later on, oh, that was the wrong step I did. When you're doing some research or you're studying a case, you go with an hypothesis, but it doesn't turn out to be right. So what's wrong with that? It's okay.
I agree with you. I think that I've realized, though, that because as physicians, if we make an error, if it's a significant error, then it can have an impact on patients.
Of course.
Not that you're saying this, that it doesn't matter, not at all. And
No.
I agree with what you're saying, but I think that's my struggle with it, that even the way the medical legal system works, physicians are expected to be perfect. To Err is Human came out in 2001. To Err is Human talked about medical error, and that all physicians, all medical professionals, unfortunately, will make mistakes. We should be able to be more honest about error. I think it's true the way you phrased it, that if we could do that and just say from the outset, this is my hypothesis or this is my working diagnosis, and keep an open mind, because maybe I am wrong, even if I'm the world expert who's been doing it for 50 years.
Absolutely. And also, when you are looking at a scenario or case, then if you're not sure, then you ask for help, get an opinion from somebody else. Now, that opinion may or may not help in the long run. As you know very well, in melanocytic lesions, on a difficult case, 5 will go in one way and the 5 will go in the other way. And the one who speaks loudest sorts of carry the weight. But doesn't mean he's right or she's right.
Yeah.
Only time will tell.
Yes.
Patient's outcome will tell.
I know that you have a consensus conference for dermatopathology at Boston University, and we have one too where we pull all of our heads and eyes together and look at difficult cases and give our opinions. It can be hard to not be influenced by whatever is said first. The groupthink phenomenon is for sure true. Sometimes when we are all able to be honest, we're split. Some people think one thing and some people think another. So do you have a method that you deal with error, since it will happen?
Own up, accept it, because that's the fastest way of coming out ahead, in the sense that otherwise you'll keep on thinking about it, or what should I say, the right word, feeling upset about it and try to make excuses. But it's best that you own it. And if the mistake is done with your full idea of what you thought was the right one, then I do not believe that is truly a mistake. It may turn out to be a mistake, but it's not. But if you do a mistake because of your negligence, because you are trying to do 200 cases in a day, then that's a different issue, right? We have to first recognize what kind of a mistake we made. Is it because of my sloppiness or is it because of my interpretation? I think the latter is more tolerable in the sense because that's my interpretation. The former is not. And if I really did that, then I have to apologize. I have to accept. And I have to say that I'm going to be extremely careful next time.
Yeah.
I have to minimize. It's not
Yeah.
going to be 100%. I wish it
Mhm.
was.
Yeah. So think of ways to avoid that in the future. So if you realize, unfortunately, it was because you're what you called sloppiness, like you were distracted or doing too many
Yeah.
cases or trying to multitask or something, you should avoid that kind of thing in the future. If it's your interpretation, though, so say, like, for example, your initial story, it had gone the other way. Like it was really this angioendotheliomatosis, this APS. And as you said, you hadn't heard of it. Or even if we take the example of COVID, when no one knew about COVID initially, right? There's something completely new and there isn't really a way to know about it until someone describes it, just like you with the intravascular lymphoma, to put a name on it with your open mind. And now we can recognize it more easily.
The learning is lifelong. One can't say, I learned it enough, because that will be the death of your career. You have to learn. I'm learning every day. And I'm learning more from my junior colleagues, my trainees, residents, and fellows, because they ask you questions. And sometimes they are tough questions. I'm sure in your practice, you will see a case, my God, I've never seen anything like that. And it can be as mundane as a BCC, but it has some peculiarities that you have never seen about it. And you wonder what happened here. So, yeah, learning is a lifelong process.
Is there anything you wish you had known earlier in your career?
Things happen a lot of times by chance, whether it's research, whether it's your personal life or your career. Things really happen by chance, not necessarily that you are any smarter than somebody else. Sometimes being in the right place at the right time make a huge difference. I've been very blessed, very fortunate. I've been very blessed with having great mentors who have helped me along to reach the stage where I am.
Yeah, I like that. I do think we don't account for serendipity enough when we're like asking kids, even 5-year-olds, what do you want to be when you grow up? There is a big factor of serendipity, like who your English teacher is or who your dermatopathology teacher is. Do you have any tips for having a successful career, whether in academia or otherwise?
Well, as I mentioned, keep an open mind, never give up. If you set a goal about something, if you fail the first time, don't give up. Try again and again. A lot of young people come and ask me they want to go and do a fellowship in dermatopathology, and it's very hard to get in. It's okay. So try again. Make yourself better. Do some more work, more publications. Make yourself so competitive that people will want you. So if it means it takes you an extra year or two, what's the big deal? Age or the time factor is not important. If that's what you want.
The younger we are, sometimes time seems longer. But then the older you get, you realize, oh, yeah, an extra year for something that I really want would
I
have
think
been or is worth it.
there are some socioeconomic factors that play into today's time of people trying to make it shorter. I was blessed that I didn't have any loans. So today's graduate, they have loans, and obviously they will like to start their career so they can start earning money so they can pay off their loans. I understand that aspect of it, but 1 year in life is not going to make that much of a difference.
That's a really good point. No one's ever talked about that before. It is true. My training was in the UC system, and I think we were paid the lowest in the whole nation, despite California having a very high cost of living. It was hard. I had loans, and I think it was a factor in when I was trying to decide how long to make my training extend for. But I think I only believed this once I experienced it. But Really, I think for most physicians, within 3 years of working full time, I think a lot of my financial stress did diminish. I wasn't so worried all the time about money. That segues into another question of mine. Do you have tips on work-life balance, like balancing that kind of financial consideration with what we want to do in work?
Yes, I would say strongly that people should take time off for their own self, at least an hour a day. In 1992, I had a major accident in which I could have been paralyzed or even lost my life. And when I came out of that, thank God that I did, I said to myself, I'm going to be selfish for 1 hour a day. Whether I go for a walk, I go to a gym, I do whatever. Because we all are so obsessed with our work. And sometimes not because we want to do that, because that's how it is. Our lives are busy and we are doing 500 things at the same time. You're writing papers, you're seeing patients, you're seeing slides, you're teaching, and so on. But somehow you need to make that time. From that time on, I made a decision that I'm going to spend an hour. You have to carve out time. We're all very busy. So that's not an excuse. Sleep less if you have to, but you have to do your hour of whatever makes you feel better. If it means you're playing golf, let's go and play golf. But you have to do something for yourself.
Yeah. Something for yourself, you mean that's not work.
Right.
Yeah. That's great advice, actually. I said it that way about something that's not work because when my kids were younger and I felt, as you implied just now, that I had no time, I felt like because I love my job, that is doing something for myself because I dropped my kids off at daycare and I felt somewhat guilty at times. I would go to work and I would feel very happy and free at work. But I do think now that I should have still been doing something else for myself. I completely agree with you. You're so wise. Do you have any final thoughts?
One, in dermatopathology, do not forget CPC. Clinical pathology correlation is of utmost importance. I'm known in my department as a CPC person.
That's good. I think that also CPC, clinical pathological correlation, becomes so useful because it makes me think again about a case from a different perspective, right? The clinical, the way the patient presented. I agree, that is really useful.
Also, as I mentioned before, I've been very blessed to have a great career, a great number of colleagues, trainees that have gone all over the world and doing phenomenal things in their lives. That's the biggest reward that one can expect. It's based on mutual respect and honesty and kindness to our colleagues, to our trainees, to our mentors. I feel very strongly that we should never forget about mentors. Very frequently in today's time, people move on and they won't forget where they came from, where they were being taught, who was responsible in their life. I'm not saying universally people do that, but that seems to be the trend. But I'm an old-fashioned person. I try to honor my mentors both in India and here, and I feel good about that.
That's good advice. Thank you so much for your time. And I appreciate all the teaching that I have had from you over the years.
Always a pleasure to speak to you. Thank you for having me.